Okay, so good morning, everyone. Just before we get started, I just wanted to go ahead and introduce myself. My name is Joe. I'm a nursing student at Loyola University, and I just wanted to thank you all for joining in so that we could go through this presentation with you and hopefully give you some helpful information about diabetes and answer any questions you might have. So let's go ahead and just get started and go over some of the basics about how the body works and how that ties into diabetes. So when a lot of people think about diabetes, one of the first things that comes up is sugar. So what exactly does sugar do for the body? So sugar is basically energy. It's the thing that makes everything else work in the body. Every living cell in your body has work to do, and in order to do that work, it needs energy, so it needs sugar. However, if sugar was just able to just enter every cell at will, your cells would all go into overdrive and they would wear out faster, and that's not good. So your body's pretty smart about this. It knows that it can't let sugar just enter in at will, so it has a way to prevent it. So if you think of cells individually like tiny little houses where things can go in and out of through the front door, the cells in your body go and lock the door and keep sugar out until your body tells them that it's time to let the sugar in. Now, with that being said, there's only one organ in the body that always leaves the front door open for sugar. And it's the one that does the most work, and it's the one that's always on, and it's always working to try and control the rest of the body. And because of this, it needs a constant supply of energy, and that organ is the brain. So your brain is the only organ that's always going to let sugar in with no gate or no door getting in the way. And that's why you'll see that some of the symptoms that come along with high and low blood sugar deal with the way your brain reacts, because it's going to be the first to know when there's too little or too much sugar available, because it's always trying and reaching out to get sugar. All right, so now to kind of keep with that door analogy, every locked door needs to have a key. And luckily for us, our body makes its own key, and it will send that key throughout the body so that the cells can unlock their front doors and let that sugar in. So that key, it's a hormone, which is just kind of a fancy biology word for a chemical messenger, and that hormone is called insulin. So when your cells start needing energy, the pancreas, which is the organ that creates insulin, it makes it and it delivers it throughout the body through your blood to let your cells open their door and let that sugar inside so they can get the energy they need to keep working. Okay, you can go to the next slide. So now that we kind of got that out of the way, what exactly is diabetes? So diabetes is essentially two problems. The first problem is that someone who develops diabetes, they've lost their keys. In type 1 diabetes, your pancreas doesn't make any. It loses the ability to make insulin altogether. And then in type 2, your pancreas essentially can't keep up, and it just doesn't make enough insulin to allow your cells to let in enough sugar to work. So now that you don't have the key, you develop the second problem. And the second problem is sugar. That sugar that was getting used by all your cells, it now has nowhere to go, and it begins to build up in your blood. And when it does this, it starts to create problems everywhere else in the body. But I don't want to get into that right now. I mean, when you speak with your doctor, they can explain more about those and the information that you can get from the center and between you and your doctor, it'll explain more about those. So then as you can kind of see in this picture here, it's divided into three. So the top part, that yellow part is the pancreas, and the healthy body, it just creates enough insulin, and then it goes and latches onto a receptor on the outside of the cell that opens up the front door for the cell, and glucose can get inside. And then in the middle picture, you've got type 1, sorry about that, where it doesn't make any, and the glucose is all just, glucose is another word for sugar. It's all stuck on the outside of the cell, and it just can't get in. And then in the bottom picture is type 2 diabetes, where initially your pancreas will go into overdrive and make as much insulin as it can because the keys aren't working. And then eventually, like anything else, it'll get tired, and then it just won't make enough, and it'll continue not to make enough. Okay, so we can go to the last slide. So Now that we know what's kind of supposed to happen normally, and we know what happens when you have diabetes, the next logical thing to ask about is, well, how do we fix it? Well, unfortunately, there really isn't a true fix for diabetes, but the thing that we can do is we can manage it. And we manage it in two ways. We can either pick the lock, and we do that by giving insulin injections and replacing the keys that our body has lost, and we replace it with something that we make a synthetic insulin and go ahead and inject it through a needle. And then we also have we do that in type 1 and eventually in type 2. Or the other thing we can do is we can work with the keys that we still have in the body, because in type 2 your body's still making a little bit of insulin, and you can go ahead and just think about that like jiggling the key in the lock and trying to get it to work. So in type 2, we do that by changing the way that we eat and how we live and how we exercise and do those kind of things. And we can also take medications to help us better use the insulin that we have, and then the insulin that we'll be giving ourselves through injections later. Okay, so that's pretty much my part. So I'll go ahead and I'll hand it off to Mallory, and she'll be going into how what happens with low blood sugar.
Hi everyone, my name is Mallory. I'm one of the Loyola students. I'm going to be going over hypoglycemia, which is also known as low blood sugar. So as Joe had mentioned, the brain needs a constant supply of sugar. And if the brain doesn't have enough sugar, it can essentially be like it's starving. Kind of like a car can't run without any gas, your body can't run without any sugar. So hypoglycemia is defined as your blood sugar levels being lower than 70. So if you check your blood sugar at home and use your meter, if you see a number under 70, you want to be concerned, because that can be very dangerous for the body. Some of those symptoms that you might have if your body doesn't have enough blood sugar would be feeling shaky or feeling really anxious. You might get cold and clammy on your palms or your skin. You can get nauseous. You might feel your heart start to race, or you get some lightheadedness or dizziness. You can feel weak or sleepy. It might feel a little confused, have some trouble understanding those around you. And if it gets, very serious, you can end up going into a diabetic coma or having seizures, which is exactly what we want to prevent, because those are very serious medical concerns. So some of the things to look out for is, if you do take insulin for your diabetes, you want to make sure that you don't take too much insulin and that you give it to yourself right before you eat something, because you want to be able to balance that insulin so that you don't drop your blood sugar and end up with these issues of hypoglycemia. If your blood sugars are low and you find that you're having this issue, one of the things that you can remember to do is called the 15-15 rule, which you want to eat 15 grams of carbs, and then you want to wait 15 minutes and then check your blood sugar again. And hopefully those 15 grams of carbs can kind of help reset your body back to a normal level and bring your blood sugars up. So, and then the other thing to remember is that you don't ever want to be afraid to call 911 if you're unable to feed yourself, or you have a family member that's unable, to wake up or eat something, because 911 can be able to fix this for you, because this can become a very serious medical concern. And that's all I have to say on that.
Hi, my name is Renata, and to kind of go off of what Mallory was saying, the opposite of hypoglycemia would be hyperglycemia, which is just high blood sugar. And hyperglycemia can kind of manifest in many different symptoms, but many people that have hyperglycemia, their blood glucose is between it starts at 126 if you're fasting, and then can go above 200 post a meal. But I do want you to take into consideration that everyone is different, and everyone's hyperglycemic blood sugar is monitored by their physician, and you need to talk to them to see where you would fall on the scale and what precautions you have to take. Now, when blood sugar accumulates in our blood system, like Joe was saying, if you don't have enough insulin, or you don't have insulin at all, that blood sugar cannot enter the cells, so it begins to accumulate in your bloodstream. Some of the signs and symptoms you're going to get are, dry mouth, you're going to be urinating a lot, you're going to be, you're going to have weakness, you're going to have a headache. And the reason for that is because all the organs in your body are starting to try to work overtime. So your kidneys are trying to get rid of that extra glucose by peeing a lot. So you're going to be going to the bathroom. And because you're going to the bathroom a lot, you're going to be very thirsty. So you're going to start drinking a lot. Since your cells are not getting that glucose and that energy, you're going to be constantly hungry. So you're going to get a headache and you're going to be weak. So you need to look out for these symptoms. And one of the symptoms that I do not have on there that is an emergent symptom is if you have very fruity breath. That is something that needs to be taken seriously, and you need to have someone, one of your family members or somebody that you're with, either take you to the hospital or, again, like Mallory said, don't be afraid to call 911 if you are seeing that symptom. So what should you do if you are having these symptoms? First, you need to use your monitor, take your blood glucose reading, and according to that sliding scale that was discussed with your doctor, you need to administer insulin, as much insulin as, per that sliding scale that your doctor spoke with you about. Either you or somebody that you trust should be able to administer that insulin for you, and wait for those symptoms to kind of decrease. If they don't decrease and they persist or they are getting worse, again, don't be afraid to call 911 or your doctor or have somebody take you to an emergency room, because hyperglycemia can have really detrimental effects. And that's all I have for me.
Hi, I'm Tiara, and I'm going to talk about medication management. So first, we're going to talk about glucose monitoring. So when you monitor your blood sugar, your blood glucose, you're just checking to see how much sugar is in your blood. And checking your blood glucose is an important aspect to see if you're meeting all your treatment goals that your doctor has set for you. And so keeping track of your blood glucose levels, it allows you to see a pattern in your levels, and you can discuss these patterns with your doctor to see what is causing your blood glucose to either go up or down. It is also important to monitor your blood pressure, your weight, your sleep pattern, and your cholesterol, while also monitoring your blood glucose levels. So it is important, you can determine what monitoring device works best for you. So you can speak to your insurance to see what they cover, but then there's also programs that can provide free monitors to people. So you should talk to your healthcare provider to determine a plan when it is best to check your blood glucose levels. But it's always going to be important to check your levels before you eat, and then 1 to 2 hours after you eat, and then before and after exercise. And so with blood glucose, it typically tends to be higher after you eat dinner or any meal and when you're sick, and then your levels tend to be lower after engaging in physical activity. And so for medication, you can have insulin dosing or oral meds. And so when you take insulin, it acts as a replacement for the insulin that your body either doesn't produce or you have the low levels that you have, and it's used to balance out those glucose levels. So when there's too much glucose in your body, that insulin that you're taking, it tells your body to store that glucose in your liver, and then that glucose won't be released until your blood glucose levels have decreased. So there are 3 different types of insulin that you can take. So there's rapid short acting, and that's usually taken before and or after meals. And then there's intermediate acting, and that's usually taken to keep your sugar levels consistent between the meals that you eat. And then for long lasting, that's usually also taken between meals, and then it can also be taken overnight to provide a steady maintenance of your glucose levels when you're sleeping. And so when it comes to insulin dosing or oral meds, everyone is not the same. So you could be taking different types of insulin or oral meds compared to someone else who has diabetes. And so when it comes to this, your doctor will create an individualized plan for you. And that's it.
Hi everyone, my name's Kate, and the next thing we're going to talk about is exercise. And exercise is important for overall health as well as diabetes prevention and management. So more specifically, physical activity is going to help manage blood glucose levels. 30 minutes a day of moderate intensity exercise is recommended. And this should include aerobic exercise as well as resistance training. Just so some basic examples can include walking, swimming, biking, or yoga. And it can even include chores you need to get done or activities you enjoy doing like gardening or cleaning the house. It is also always important that you wear identification that tells others that you have diabetes. And this can be obtained from your primary care physician. And then just lastly, before each exercise session, it's really important that you take a moment to check your blood sugar levels. And this is to ensure your safety and to ensure that you have enough energy to complete a workout. And then you would also want to complete a brief 5-minute warm-up. And then you would also want to complete a 5-minute cool down after the exercise. And then you would want to recheck your blood sugar and then replenish your body accordingly. Next slide.
And I'm Sarah. I'm going to chat with you a little bit about nutrition. So why does diet matter with diabetes? So a good diet with regular meals actually helps control blood sugar levels, which can help improve your body's natural control of insulin. This may mean for some people even less medications. It can prevent complications that arise from diabetes. And it can also have the benefit of reducing the risk of other diseases like heart disease or cancer. So what are the basics? So we want to have healthy carbs, which think whole grains, and fiber. And the good thing is that those two go hand in hand. So if you're eating healthy carbs, you're getting good amount of fiber. The next thing is good fats. So not all fats are bad. You want to look for good fats like avocados, olive oil, fatty fish. These are all really great sources of healthy fat. And the things we want to avoid are salt, sugar, and the bad fats. So that essentially means anything that's fried, anything that's really processed. We want to try to keep our diets as natural as possible. And then just a quick side about carb counting. So you may have talked about this with your provider or at the center, but just a quick reminder that one serving of carbs is 15 grams. So I know Mallory talked about the 15-15 rule. That's where this is coming from. So one serving is that 15 grams. It can be bread, vegetables, fruit, anything with quick sugar if you're feeling like you are having a low blood sugar. And nutrition labels are your friends for this. So you want to be careful about nutrition labels. Make sure you're reading those really well and seeing how many servings of carbs are in that item of food. So this sounds simple to say, but it can be really hard, we all know, to adjust our diets. So one method to keep in mind is the plate method, and you can kind of see the picture here. Half the plate is with non-starchy vegetables, so salads, plantains, cauliflower is really good. And then a quarter of lean protein. That can be tofu, paneer, turkey and chicken, eggs, and then the other quarter with grain. And again, we want to remember whole grains, so whole wheat tortillas, brown rice, or you can just double up on the veggies. It never hurts to have more vegetables in your diet. And then it's hard to tailor it to yourself. I have some more info here directly from the CDC or for specific diets, so South and North Indian diets and Hispanic and Latino diets to kind of tailor it to yourself. Next slide.
Hi, I'm Lauren, and I'm going to be talking to you guys about the health risks associated with diabetes. So because diabetes can cause damage to blood vessels all over your body, it puts you at a risk for a number of complications. Excess blood sugar decreases the elasticity of blood vessels and causes them to narrow, which makes it harder for blood and oxygen to get through to certain parts of your body. And this can lead to a reduced amount of blood and oxygen, which also puts you at risk for high blood pressure. And high blood pressure then puts you at risk for things such as like heart disease and other cardiovascular diseases. So you can see that even these like small changes can lead to bigger health concerns, and it kind of becomes a cascade effect. So it's important for diabetic patients to monitor glucose levels and maintain control over their diabetes in order to prevent these conditions. It's important for all patients to check in with their primary care provider and go to yearly physicals, but especially for diabetic patients. And on the next slide, I'll talk about just lifestyle changes that can help with these health risks. Next slide. So research shows that unchecked stress can lead to a number of health issues, including increased blood sugar levels. And so here I just have a number of different activities to reduce anxiety. The first one is to exercise, and we talked about exercise before, but just a reminder that exercise can be aerobic or anaerobic activity, and it's recommended that it's done 30 minutes a day, 5 days a week. And the trick to this is just to choose an exercise that you enjoy doing, and this will help you to stay on track. Another thing that you can do is meditation. So meditation is definitely not for everybody, but this can be done just for 5 minutes in the morning, or it can be done when you're feeling like increasingly stressed or overwhelmed through the day. And this will help you to become more mentally clear and emotionally calm. Another thing here is to join support groups. So this can be done virtually or in person. And later on, we have a number of support groups and resources listed for you guys. But this is an opportunity to talk with other people that have diabetes, and this can help you to manage it. And then one of the last things here is reducing or eliminating caffeine and alcohol, which can help to reduce stress. Not only do both of these increase blood glucose, but they also elevate cortisol levels, which is the body's stress hormone. So just generally speaking, stress management will help you improve diabetes, but it's also great for lifestyle and balance. And we can move to the next slide.
Hello, everyone. My name is Charlie. Now we're going to be transitioning into the final portion of this presentation. We're going to cover resources for diabetes, and then we're going to follow up with a pop quiz, 4 little questions. We'd love for you guys to participate in those questions. They're really simple. And then we're going to conclude with just some helpful tips regarding how to navigate healthcare. And then, like Leah said, we're going to also have opportunity for you guys to have ask your questions that you may have for us. So some resources for diabetes. The classic way of going about just like documenting glucose specifically and tracking it is using a little journal, like you would at home if you would journal your thoughts. Likewise, you could have a little journal to document your blood glucose. And then likewise, also we have a plethora of apps, as you can see listed on this slide. If you have a smartphone, you can download one of these apps, and you can essentially record your blood glucose before you go on your morning walk, or if you are a runner enjoying in the afternoon going for a run. Likewise, you could document that before and after. And if you notice your blood glucose is low, you can go ahead and take some, get some food, yeah. So, and then as listed also below that, we have some sites, the American Diabetes Association and the CDC. Those are really good resources for recipes and for research, and then also just to be able to find community with other individuals with diabetes is just super helpful. And there's also really cool podcasts as well. We can go ahead and transition to the next slide. All right, so this is our quiz. The first question is a true/false question. Diabetics cannot eat any sugar or dessert. True or false? If you want to answer, you can go ahead and answer by unmuting yourself or responding in the chat.
False.
All right. Yes, so it is false. If you go ahead and Lydia transition to the next slide. As you can see, it is false. You can eat sugars and sweets. Just be mindful of what you're consuming, what you're eating, and how much of it. All right, you can transition to the next slide. All right, diabetics, happens because of all problems in which organ? A, stomach, B, pancreas, C, brain, D, I don't know.
Oh, we have an answer in the chat.
Yes, that is the answer. Correct. Well done. That is right. And is the storehouse for our insulin that helps us process the sugars in our food. Well done. I love it when you guys participate. It's great. All right, question 3, true or false? I should skip my insulin on days I'm sick and not eat as much. True or false?
False?
It is false. Yes. It's important to follow your sick day plan because your body needs the energy, and it's important to store those sugars in your blood. And so it's important to make sure you're monitoring how much insulin you're taking. That's on the next slide. Sorry. Yep. Perfect. All right. And then last question. What kind of shoes should a diabetic wear? A, sandals. B, barefoot. C, closed-toed shoes or properly fitted shoes. D, I don't know. All right, you can transition to the next slide. The answer is C, closed-toed shoes. And as we had discussed and on the slide, I believe Lauren was talking about this is the importance of wearing closed-toed shoes because DM patients or DM individuals have more likelihood of contracting ulcers and cuts on your feet. And so wearing closed-toed shoes is just a way of preventing that. All right, and then this is the final slide. This little slide is just about essentially Ask Me 3 is the terminology. And basically when you're navigating healthcare and navigating the complexity of the language and the jargon, et cetera, it can be really hard to understand physicians and doctors. And so one way of going about knowing what's going on is by asking these 3 questions. And the first question is, what is my main problem? 2, what do I need to do about that problem? And then 3, why is that important to me? And to do these steps. And having these 3 questions on hand in your little journal or on your phone, just so that you know exactly what the doctor is saying regarding your medication, your diet, what you should do, what you shouldn't do. Having these 3 questions will help you remember essentially the most important information when you walk out of that doctor's visit. So this is good for everyone. This is not just good for you guys, it's good for us as well. So, yep, so we can transition to the next slide, and it's just an opportunity for you guys to ask any and all of us any questions you may have. You can also write your questions in the chat box if you're more comfortable with that.
All right. I'm not seeing any questions coming in the chat box, but this was.
Here we have one.
Oh, we have one?
Yeah, so this one says, what if you don't have your glucose meter and you feel dizzy? How do you know if blood sugar is too low or too high?
Yeah, so I would say anytime, if you don't have your meter on you and you're feeling dizzy, if you have a quick sugar like a juice or even a candy bar, just go ahead and take a little bit of it, see if that makes you feel better. And then when you get home, if you do feel better, you can check it then. We would rather you have a little bit of sugar than to be dizzy and have a hypoglycemic issue.
Right, and also to what Sarah said, for hyperglycemia, if you're going to the bathroom a lot and you're feeling really thirsty all the time and you're just constantly hungry, that would be a sign of more of hyperglycemia. And so that's when you need to have your insulin and be able to administer it. But it's always good to have your blood glucose monitor on you, especially if you you are a diabetic. I know there's instances that you might not, but just looking out for those signs and being conscious of when you ate, what you're actually doing. Like, are you, out gardening? So that is also physical exercise. So it's going to deplete your glucose. So being kind of conscious of what you're doing and, your last meals is very important as well. You're welcome.